Aujourd'hui, nous recevrons une très grande organisation, donc une organisation qui fait beaucoup de choses pour la communauté. Donc, et pour cela, j'ai deux invités très importants ici aujourd'hui. J'ai la docteure Linda Bello et j'ai docteur Kojo Degnecho qui est aussi ici avec moi. Salut à tous et bienvenue sur Afrique Today.
Salut.
Ok, aujourd'hui, c'est une émission très spéciale. Nous allons faire l'émission en anglais. Donc, tout d'abord, je vais donc commencer par Dr Linda Bello. Dr Linda Bello, est-ce que vous pouvez vous présenter et présenter l'association que vous représentez aujourd'hui? Can you introduce yourself and tell us a little bit more about the organization are you representing today?
Yes, thank you so much, Ala. As you rightly said, my name is Dr. Linda Bello. I'm the chairperson of CamDocUK, and I'm here today with my vice chairperson, who you shall hear from in a minute as well. His name is Dr. Kojo Degnecho. So yes, we're here to represent CamDocUK, and CamDocUK is an organization of like-minded individuals and allied medical professionals of Cameroonian origin living in the UK. It is a forum for us to meet and share ideas about various aspects of healthcare. It's also an environment that we use to socialize, and we also encourage mentorship and constructive debate, so we have a lot of that. We also want to forge partnerships with stakeholders in Cameroon, and we also provide professional expertise to issues related to healthcare development expertise. So if I can tell you just a little bit more about us, we were born, CamDocUK was born on the 1st of March 2008. We had there was an inaugural meeting in Leicester, which is a beautiful town in the United Kingdom. It was really born out of a desire for Cameroonian medical professionals to get together, share their experiences, support each other, and work towards improving healthcare in our communities, both within the UK, where we're all living, and in Cameroon. And so far, we've done a few things. So in 2011, 3 years after we formed.
Yes, doctor. We will write back to that question soon. And I would like to introduce also another guest we have today is Dr. Kojo Degnecho. Please, can you introduce yourself? Can you tell to all the viewers a little bit about you? What are you doing before we go inside what the organization is doing?
Okay, yeah. Thank you very much, Alain. I am Dr. Kojo Degnecho. I am the Vice Chair of CamDocUK. I am a forensic physician, so I work a lot with the police forces in terms of investigation and people in detention and crime and stuff like that. I've been in CamDoc right from the get-go, so in CamDoc as a member for over the last 12 years in different capacities. CamDoc, as Dr. Linda Bello put it, it is really an association which is aimed at bringing together the various professionals who have got a Cameroonian origin, and with a whole goal of taking care of ourselves, improving ourselves, and also improving our community, doing things both here in the UK and back at home.
Thank you so much, doctor, for that. And we was talking with Dr. Linda. We was talking about this organization, CamDocUK. Again, just for our viewers, because I just cut you a little bit to introduce Dr. Kojo. Could you tell us a little bit again more about this organization, Condo, where it was formed, and who did that, and
Yes, so thank you, Anna. So as I said earlier on, CamDoc started in 2008 in a small town in the UK called Leicester, and really out of a desire for all the medical professionals to sort of get together, share their experiences, support each other, and work towards improving healthcare in both here and in Cameroon. So I was saying so far, what we've done to try and help with that since 2008 was that in 2011 we were officially established as a UK-based charity. And then following that, the next year we created our 5-year development plan, and we started meeting with other like-minded groups. One of them was Campo Medics, where we did an unofficial, we did a collaboration. In that year as well, we also did some teaching at the University of Buea in Cameroon. And then in 2014, we officially registered with the Cameroon Medical Council and the Cameroon High Commission. And we've donated books to the University of Buea. So far, we've established a mentorship for children. And we've also donated 50 beds to hospitals in Cameroon. In 2014 as well, we also visited Cameroon with a delegation from World Orthopedic Concern. And then in 2016, we've established a small grant scheme, and we have there was volunteer operations of 400 patients. And we've also been involved with Counseling for Women and Mentorship for Children initiative. And then in 2018, we started having lots of official relationships with the University of Montaigne, BAPIO, which is a British Association for Physicians of Indian Origin, and the University of Chong. So we're quite proud of how far we've come in such a short space of time. We've still got a lot that we're doing, and we're going to touch on that hopefully throughout the program.
Thank you so much for that. Thank you so much. It's very interesting for what your organization doing. Now I have a question for Dr. Kojo. Dr. Kojo, can you tell me a little bit the benefit of membership, please?
Okay, yeah, so thanks for that, Alain. The benefits, some of which I already hinted earlier on, and Linda has sort of touched about that. The idea of becoming a member or joining in this is that it offers one, and the first and most important thing is that we are working and operating in a foreign country. So it offers the space of community, pastoral support, social interaction, not just about the individual members, but also of their families, and even we're now getting to the stage of our children. So it offers a lot of that social thing, and it's immensely important when you are living abroad, where we bring this, we sort of come in and interact with our culture and talk about things which are very specific about us, the difficulties, and we also offer pastoral support, which is what you call in French encadrement. You're helping people to help them in their profession, to how the best ways, the things that are suitable, career advice to colleagues, from training, from trainees, right up to even the super specialists, the professors themselves, offering each other support. And also what we call advocacy. That means if you are running and you are having problems in a specific area, we can offer advice on how to get yourself out of that, to defend yourself, or how to strengthen yourself in that area. And that can be not just only for members, but also for our community out there. Those are the things. We also offer a lot of teaching sessions. inside the organization. So we provide teaching because it's an association that has got over 12 specialties, doctors in over 12 specialties. So some of them are more advanced than the others, and they will also, so we will provide training, teaching, development, not just in my area. For example, I may come in and I talk about forensic medicine to my colleagues. My colleague who is a gastroenterologist would also be offering lessons and things to talk to the other colleagues about common problems that we would find as doctors anyway. So it's a lot of teaching going on even amongst doctors. So the fact that we have finished medical school or we are now working, the learning doesn't stop, it continues there. We also offer facilities within the CamDoc, especially nowadays with the COVID now, where we do not see people face to face as much as we do. We are offering this platform, things like webinar sessions, so our members can use the webinar service of CamDocUK to organize meetings, to organize training with other people. It's a lot that's there, but most famous is the one of being together and not feeling alone in a foreign land.
Wow, is very interesting. Dr. Linda, before I ask you my next question, I just I just wonder. This is just a personal question. The organization is based in UK. No, is work for Cameroon. This is what my understanding. Correct?
Sorry, I missed that, Alain. Did you say, could you repeat the question?
Yes, I say the organization is based in UK, no work in Cameroon.
It's based in the UK for doctors of Cameroonian origin working in the United Kingdom. So nearly all of our members live and work in the UK. If I think that's the question you're asking me.
Yeah, yes.
So
No, my
yeah.
question was: is you also have a filial in Cameroon, or you do also something for the Cameroonian people, or you work only in UK?
Oh, no, not only in the UK. So as I was saying in the introduction there, that we're quite keen on supporting healthcare for Cameroonians living in the United Kingdom and also for the community in Cameroon. So most of our education videos or webinars, those would be focused on everyone. So, but mainly people living in Cameroon and our community here. So it's just the fact that the doctors that can actually join the association should be living in the United Kingdom. There are other associations, similar associations in Belgium, France, Italy, Swiss, and they go by different names. And we do work together, and we're all kind of working towards the same goal.
Okay, I understood now. Now, we have a pandemic, a COVID-19. Can you tell us a little bit about the COVID-19 and the new way of working?
Yes, yeah. So I think Dr. Denecho was hinting at this as well, that actually the pandemic forced us to create new ways of working and new ways of passing on our message. And the obvious choice was that we had to do everything virtually. So we usually have at least 4 meetings a year, and one of them is usually our annual general meeting, where actually most of our members look forward to that, because apart from a morning of education, in the afternoon we get to eat and dance. And this year we had to do it virtually. And virtually means use of Zoom. So we've been using Zoom a lot. Obviously, there's also Skype and other avenues. So we realized that we really had to embrace this virtual working, and one of the main things that we started in June this year was our webinar series, which we used. We're using this to educate our community. So we usually have some CamDocUK members as part of the panelists, and we're bringing some external speakers. It's broadcast on Zoom, and it's very, and we have our members from the community asking us questions, which we answer live. So we and also when we finish that, we do record that and put it on our YouTube channel so that people that were not able to watch can come and watch again. And just to give you a flavor of the sort of things our webinars have been about, the first one was about COVID-19, talking about COVID-19 with the community. That was very well attended, and we had lots of questions about COVID, and we were telling them about how to keep themselves safe. I actually was one of the panelists on that one in my role as a GP, telling patients how they could manage COVID-19 at home. One of our former chairpersons, who is now living abroad, was also on there. He's a respected consultant in infectious diseases. He was able to give us a lot of information on what was going on. So we've had a lot of these. We had another webinar on African remedies and drug trials and COVID-19 vaccines. We had some on A Day with Your GP. We had one on flying during COVID, and actually our next one is due soon, and we're going to be talking about nutrition and health. So the feedback we've got so far from these webinars have been really positive, because obviously we're here, we're giving our time, we're giving our expertise, and any questions that are asked, we're always trying to answer. So if any of your listeners or the audience watching now, I would urge them to go to our CamDocUK.org website, and it's all on there as well. And we're passionate about sort of trying to educate and help during this period. And actually, before I finish on this, a lot of the topics that we talk about, we did actually do a survey of the community and ask them, what would you like us to talk about? So it's always been quite interactive, and that's what we like about that. And last but not least, we've done a lot of educational videos. So we had one video on hand washing, which that one we had lots and lots of people watching that. Just simple thing about sort of how to wash your hands. We had another one about mythbusters. What are the things that you've heard about COVID-19 that are true? What should you ignore? So we've really ran with it, if I can say, and I have lots of members that are really helping with this. So I would say personally that that we've really embraced this. We're on all the social media pages, and we're easily found there: YouTube, Instagram, Twitter, and Facebook.
Thank you so much, Doctor, for that very interesting information you give to our viewers here on Afrique Today. I just want to remember this edition on L'invité du dimanche. Today is the English version because our speaker today speak in English. Alors, si vous regardez Afrique Today, je vous rappelle que vous pouvez nous regarder en même temps sur 4 plateformes: Facebook, YouTube, Twitter et sur notre website afriquetoday.com. Je m'appelle Alain Pierre. Alors, l'invité du dimanche, c'est une émission qui passe tous les dimanches à partir de 15h heure des États-Unis. Il sera certainement 21h là-bas à UK. Okay, you watch us and you can just download Afrique Today app. We will take a little bit break, and when we will right back, we will talk more about this amazing organization, CamDocUK. That will happen just after the break. See you. Retour donc ici sur Afrique Today. Welcome back to Afrique Today. Je m'appelle Alain Pierre et today we have a special edition of l'invité du dimanche. This edition is English version today because we have a very big guest from UK today, and we spoke about a very fantastic organization, the CamDocUK. On the first part of this show, Dr. Linda Bello was talking about the organization, what the organization do, how they dealing about the COVID-19 or all those things. They're still here with me here on Afrique Today. Welcome back.
Thank you.
Thank you. Merci.
Okay, I'm very happy we are here today. And my next question will be to Dr. Kojo. Dr. Kojo, could you tell me a little bit about your PPE project you have now?
Yeah, thank you very much, Alain. I mean, this has been a very, very important thing, both for the world. As we know, it's called a pandemic because it's an infection that has gone around the world. It has gone around the world, and it has come to Africa, and it has also come to Cameroon eventually. We in Europe, we had it after China. And it was very overwhelming. It was very, very stressful for us here in Europe. I mean, countries with very big, strong health systems, rich countries. And immediately it set upon us what's going to happen to our people back home. And we set upon ourselves to mobilize ourselves and try and do something for it. And therefore we came to the realization we wanted to make a project, what we call CamDoc, the Cameroon PPE Project. We thought in a very strategic way that, of course, helping the whole country would be beyond our means. But we thought that the best way forward, the best and the most effective way would be to target our healthcare professionals, those doctors, those nurses, those physiotherapists who are in hospitals, whether they're big hospitals or small centers, from whether it's from Isanje or it is in the north or in Douala or Yaoundé or Boya or Bamenda, wherever they are. Those are the people who will be vulnerable, because we ourselves as doctors here, we were vulnerable, we were open to this infection, and it needed protection. And you will hear the word PPE, which is personal protective equipment. And that is it is anything that helps you, the healthcare professional or the person, dress up in a way that it creates a barrier between you and the illness. And so you would understand that anyone who is treating patients is going to be very, very open to this infection. And those are the most valuable people we can find in the society. A nurse, a doctor who has trained for so many years, if you lose them due to this illness, it is a very big loss to the country. And they were there. So we came up and we decided we were going to do fundraising to try and get money to buy personal protective equipment for to send to doctors or healthcare professionals who are working in hospitals. And we started at the end of the 31st of March. We thought we were going to just work towards £5,000, so somewhere around 5 million francs. But my word, we really went beyond the success of it, the passion and things, and we ended up going and raising over £19,000. We're talking of close to 16 million francs CFA. CamDoc put its own money in it, and we ended up purchasing equipment for over nearly 22,000 pounds over a period of time. we were very grateful, very indebted to our members, to all our community, to all the big associations of Cameroonian, be they those from alumni organizations, so those from other secondary schools who were gathered here, be there from people from little tontines, and jangi houses. They gathered together, raised money, and they trusted CamDoc that this is a matter of health. They can raise money, but they do not know what equipment to buy. So they thought we would be the ones who would be able to do it. And we really very much grateful to the Cameroonian community and also others who are even beyond the United Kingdom who joined the effort and to raise this money. We have then used this money. We tried to buy some things in Cameroon, so tried to see some of the things, but we ended up having to buy a lot of the equipment from China. So we've got we got over 10,000 gloves, les gants, and we had 1,000 face shields. So those transparent things that protect the worker from others. We had 13,000 face shields. What we call is surgical masks to protect them. We also had alcohol gel to protect, to rub hands, and we got all of those things for that sort of amount. The goal and the target we said was that we were going to reach all the 10 regions in Cameroon. We would strategize, we would try and look and identify those who are more affected and have got little support than others. Some bigger, some hospitals may have more equipment than others. But anyway, a doctor or a healthcare professional working even in a district hospital or in a health facility somewhere else is also in danger, just like somebody else who's working in l'hôpital général or la cantine. They will be the same. So we were going to identify 10 institutions in all those 10 regions. So we're talking, it's a big task of 100. I'll tell you that we have succeeded we've started the phase, the first phase of donation, of distribution of this thing. Some of them, because of the security issues also in different parts of the country, we cannot certainly say exactly where, how, whether in what areas we've done so far. But we have gone 4 of the regions in Cameroon, and we are now going to be moving in the next 2 weeks. We're expecting to cover 6 to 8 regions, and we hope that in about 6 weeks we will have rounded up serving the 10 regions in Cameroon. That's our goal, and we are indebted to everybody. We do it so with passion, and we are really hoping it does go a long way to help and make our colleagues in Cameroon, those in those 5 areas, that they are not forgotten, that they are not alone. And that's the thing, that's the great mission. And we thank you, even for you giving us the platform to be able to share this message. It may look a small organization, but we are doing big things.
Of course, you are doing very well. And before I give my next question to Dr. Linda, I want to come back to another question I give you in the first part on this show. We was talking about the benefit of membership. How many members you have now, and who can become, what you need to become member? I'm asking my question to Dr. Kojo.
Okay, yes. Thanks, Alain. So far, the CamDocUK has got 70 members. 70 members. However, the affiliations and things that can be more and less at certain times, because we have doctors who are coming to the United Kingdom. They're mainly got to be based in the United Kingdom to be members. But not just that, we have people who have been in here while they were doing their training. And after they've trained, they've gone to other places. Some of them have gone to the United States, some of them have returned to Cameroon. We span, so there are 70, but we span 4 continents now, the doctors who have been here and who continue. They want, even though they've left the United Kingdom, they want to still continue with the vision and supporting that mission that CamDoc has to help our community. So some of them are abroad, some of them in places like in the Middle East, Qatar, United Arab Emirates, other European nations, the United States, but they've still decided to continue, and those who have gone to Cameroon. So it is a United Kingdom-based association, but not just that. Okay, and to be members, you have to invite. There's all the information on our website, www.camdoc.org, on how to become members. The members are not only doctors, they can be allied professionals, which means professions that are who work with the same doctors, who work to promote health. It is not only that, even people who are not doctors, but who've seen what we do, and that they really want to help our association, they can become what we'll call honorary members. They can join us. They can do that. But all the information on how to become a member of it is on our website. And so it is not just doctors. It is not only allied professionals. It can also be those students who are studying to become doctors. We have those who have just trained and still young, and we have those who have already finished and specialized, and those who are even professors. They are still our members. We also have health scientists, because we also know this is to be able to do work. It is not only us specialists as just doctors. We try to work with those who are working around there. So if you go into a hospital, not everybody in the hospital is a doctor, but they all join up to deliver health.
Thank you so much for that information. And now I would like to come back to Dr. Linda, because you was talking about the PPE project your organization is doing. My question to Dr. Linda is to tell us a little bit about the cooperation with the diaspora groups.
Thank you for that, Alain. And yes, I'm sure you can see how much passion we both have for CamDocUK. And I just wanted to reiterate, our website is camdocuk.org, where you'll find out everything about membership. And there is a link on there where you can send us a message, and we will reply that, and we will give you the forms to join. So lots and lots of different types of membership, as my colleague Dr. Denacho was alluding to. In terms of cooperation with other diaspora groups, I briefly mentioned that we have similar organizations in different European countries. So in Germany, there's the Campo Medics. In Belgium, there's Medcam Bel. In France, there's Medcam France. In Switzerland, there's Swiss MD. And in Italy, there's AMCI. And we all work together. And we have the presidents of all these organizations are usually cooperating with each other. We tend to come and attend each other's AGMs if we can. And in fact, for the PPE project, we did work on some of it jointly. So it's very, very useful to have that. As I said, we support each other during each other's meetings. In the UK, we also have other groups, so the ones that we also work closely with are the nurses group. So the nurses will have their own group, and because we started doing all these webinars, and we're going to be looking to collaborate with them even more. And most importantly is one of our recent contributions with, or collaboration, should I say, with the Patrick Foundation. I believe you know them well. And we've last year we provided some members for a medical mission to Cameroon with them, and we're also jointly working with them to in the domestic violence series that we are currently working with you on. So there's lots of room for us to collaborate. We also collaborate with other countries. So BAPIO, I mentioned the Indian doctors, MANSAG, which is the Nigerian. There's just so much room. And what COVID has shown us is that we're stronger together, you know, and we share resources. You know, WhatsApp, what did we do without WhatsApp? There's groups for everything. There's groups for presidents of the doctors associations in Europe. There's also a general group for heads of all the we call them BAME, so black and minority ethnic groups. So we all have one group on there where we sort of send out joint messages. And as I said, you know, together we are stronger. So, you know, as CamDoc, Dr. Denicho was saying, we're a small organization, but I think that we've really shown that where you have passion, where you have heart, where you have the will, you can achieve great things. And, you know, we would welcome any members that wanted to come and join us. There's lots of different membership options. Thank you.
Thank you so much for that. Wow, this is very fantastic what you're doing, and to have that kind of organization is very amazing. And I would like to come back to Dr. Kojo, because he was speaking about the PPP project. And can you tell me a little bit about the future project do you have?
Yeah. Thanks for that. It's always we thank you so much for offering us this platform. This really helps us to talk a bit about. You see, COVID is unfortunately it has passed, but it's going to be with us for some maybe 1 or 2 years at least, a serious problem. And so that means we have to be looking at trying to solve those problems, trying to mitigate, that is, trying to reduce the complications, trying to be a step ahead as we are learning, as we are progressing. We are learning how best to tackle the disease, but it also means we can see in the future what is likely going to be the problem. So we would be continuing. This is phase 1 of our PPE, that is the personal protective equipment stage. Once this is over, we will be looking a bit further on how we can go on with more training with the community, but also with the healthcare professionals. What sort of literature, what sort of the latest advice, the latest research that is coming in, we would be transmitting it to them. We'll be doing so using this same social media platforms, but also now that we are also distributing PPE to those professionals, we are also getting their personal details. We're getting their email addresses, and so that means we can also write to them. We can inform them very quickly about things which would help them, or help them in better treating the patients, but also help them better to protect themselves. That will be some of the things. We've got a three-year development plan. We are looking a bit in the future about oxygen. Now, if you look in modern hospitals, and when you are treating patients, either because of COVID is one good example. It's a respiratory illness, which means that it affects the lungs predominantly, and the main symptoms are that people can breathe. So you need to help them breathe better, and that means you try to supply them with more oxygen. Oxygen is the most important factor of air that is useful to them. So we are looking in the distance, we're thinking that the need for oxygen is going to be very high. And we're trying to see about what type of equipment that can create oxygen for hospitals. Because once we do, a lot of people will be able to do this, but the supply of oxygen to these facilities is very, very limited. The capacity is very limited. So we are strategically looking at it. This is a very expensive venture. We're talking about somewhere upwards of $20,000 to $50,000 project to be able to see about supplying the best and the most efficient way of supplying and helping with oxygen supply. This will be some maybe for COVID, but there are going to be benefits later on when people have surgery, when people have got other respiratory diseases, pneumonia, asthma, and things like that. They do need this supply of oxygen. Some of it is so essential. It's safe. It's so, somebody with an asthma attack, if they have oxygen for a certain period, within that, for that 30 minutes or a few hours, it will save their lives. So not only for surgery, and not only for COVID, but beyond COVID.
Wow, thank you for that. And I would like to say with you as we wrap up, this is will be my last question. I would like to start with you, Dr. Kojo. What you would like to say? You say we experience a lot of issues while this COVID-19, and we learn a lot of stuff. What you can say to all the viewers watching us now about the situation and what we can do next time if we have another pandemic.
Sure.
This is the last word I can give you because we're almost done with the show.
Yeah. Alan, could you just repeat, because there was at the beginning of your question, the sound went, so I didn't hear. I don't want to answer.
Yes, my question was your last word related to the COVID-19, what we can do as a diaspora, what Cameroonian can do after this pandemic, because the pandemic started, maybe it will gone. You are a doctor, maybe you can tell us. And after that, what we can do to prevent another pandemic, because I know a lot of people change the behavior and a lot of things change now after this pandemic. What is your last word? Because we are at the end of the show, what you can say to all the viewers to be prepared and what we can do, because a lot of people I know who lose a job, who lose a lot of things, who close a company. Is a little bit crazy.
Yeah.
What you can just say, because we are already on the end of the show.
At the end of it, yeah. Thank you. Thanks. Well, it's been a big learning for everybody, including us doctors. I would not tell the public at all anything different. It has been a big learning experience for all of us. But one thing is that as human beings, we have to be very, very optimistic. I'm very optimistic also. We were worried very, very much about how the pandemic would affect Africa. The pandemic is not yet over, but there are great signs that we have not been, the worst case scenario hasn't happened as we feared. But the good things that have come in is that we have now learned to behave and treat ourselves better. Our hygiene has been very, very good. Now, the hygiene of washing your hands before you eat or before you meet, you contact other people, is not only going to be beneficial for COVID, it is beneficial for cases of cholera. It is going to be beneficial for cases of preventing you having dysentery. All those diseases that come from dirtiness, infectious diseases mostly for us is due to poor hygiene. Now people have learned. It's good to see children. It's good to see those adverts by the Ministry of Health, other organizations telling you we have to wash our hands. Now that benefit is going to be for us for other things, as we say. The other thing is that of telling us to be very mindful. If you have got a cough or cold, how to cough, how to prevent. those sort of things. It is not only going to be for COVID, it is going to be for other illnesses, other infectious diseases. We have also, remember, we have things like TB, tuberculosis, we have other infected diseases from whooping cough to other things. It will help people to be better. It is also a lot of people have researched and found out that, oh, we need to eat well, we need to eat healthily. Is it and that is helping. Good nutrition will be helping, and we are talking, one of our webinars is also talking about nutrition, and although it's talking about nutrition and COVID, but it's not only about that. So good feeding is going to be good. So I am very, very happy. I'm very that this is also going to be positive. We have embraced what seemed to be a disaster, and we are taking it to make it to become an opportunity of good health and a brighter future. It has taught us not to only work amongst ourselves, doctors, but to work with our community. It has taught us to work with other sister organizations. It has taught us that when we are together, we can beat the impossible. That's the message.
Thank you for this powerful word. What about you, Dr. Linda? What is your last take on this one?
Well, Dr. Denecho has said it all there. I mean, I don't know if you saw me shaking my head, that, it's easy to be negative. It's easy to think, oh my goodness, when will this end? But I think we should take positives, all the positives that Dr. Denecho has mentioned. We've learned so much. A lot of people know about their health now. A lot of Black and ethnic minority groups now, they know I need to check about my diabetes, because they know diabetes is a risk factor, independent risk factor for a poor outcome from COVID. So some of my patients that I hadn't seen for a while are coming. Oh, doctor, I need my checkup. I need to make sure my diabetes is controlled. I need to make sure my blood pressure is controlled, because they know that it's important to keep these diseases under check. Nutrition, we're having a webinar on that. People are becoming more conscious about what they're eating, wanting to make sure that they have foods that are going to boost their immune system. So we're still in the middle of the pandemic. Things are going to improve. We hope, and we're in this together. We're going to provide all the educative videos that are needed. Any questions, we've got a question and answer button on our CamDocUK.org website. If any of your viewers have questions they want to ask us, go and ask us, go and put the question there. We'll come back to you with an answer. So we're there for you. There's so many other organizations doing the same thing. Yes, one last word, keep hope, and come to CamDocUK.org website, and you'll find there are lots of doctors that are very caring and want to be there to help you with your health and beyond.